Nearly 20% of children ages 2 to 19 are considered obese. All this added weight contributing to a host of health problems, including high blood pressure, type 2 diabetes, and other issues. Well, healthcare providers are working to stem this epidemic. Let's welcome back Dr. Janice Key, Medical Director at MUSC's Boeing Center for Children's Wellness, and its Diabetes Project Coordinator and licensed dietitian Kerrie Hollifield. Ladies, great to have you back with us.
Thanks for having us.
So when you talk about childhood obesity, South Carolina ranks quite high on that list. Dr. Key, can you talk a little bit about just where this epidemic is coming from and what you're seeing as a doctor?
Well, it was a surprise. When I was in training, we didn't have children with obesity. We didn't have children with type 2 diabetes. It never happened.
Wow. And
starting in about the 80s, children started to become more and more obese until now it's really peaked at 20%, and then when you add overweight to that, it's almost half of kids sometimes.
Wow.
So there are many, many factors. It's not just individual behavior. It's not that the kid themselves is eating extremely differently. It's our whole environment. We drive everywhere in a car. There's hyper-processed fast food everywhere, which is a convenience, but we end up sitting in a car eating bad nutrition.
Right.
They sit more in school than they used to. It's many, many things.
Sure. Yeah, there's many factors.
Many factors, which is why we had to shift from we as doctors taking care of kids one at a time. We still do that. We still give advice one at a time, but we shifted to working on their environment where they are, which is schools.
Yeah.
And that's our program. The Boeing Center for Children's Wellness works with schools, about 21 school districts right now, about 250 schools, to help them create a healthy environment with good nutrition, lots of physical activity, and also mental health prevention for the kids and the staff.
Because it's such a domino effect. When
it is.
You carry that extra weight, it adds depression and you don't feel well, and there's a stigma attached to it. So you see a whole host of problems.
Yes.
Now, for you as a dietitian, Kerrie, the doctor had mentioned some contributing factors. Now, is genetically modified food also problematic in today's diet?
So genetically modified food, that is generally recognized as safe, but we really want to just go back into what the eating patterns of the children are, their sleeping habits, their physical activity habits, and looking where they spend most of their time, like Dr. Key was saying. So again, looking at they're spending most of their time at that school level. I mean, before school, during school, after school. So again, with our MUSC Boeing Center for Children's Wellness, helping the schools, supporting them on forming those wellness committees and looking at the goals and the needs of the school to implement those wellness initiatives.
Now, I know that schools are doing a better job these days of implementing healthier foods and more locally grown foods and things like that. When I was going to school, not so much. But you talk about the 80s, and I guess that's really interesting that you started to see that trend, that trajectory. But what can parents do today in terms of feeding their kids, because there's also a socioeconomic component to this, that we're seeing more children that come from a lower income household developing obesity at a much younger age. But what can parents do to incorporate healthier food into their diet?
Absolutely. So we really encourage parental involvement because we see a decrease in overweight and obesity and BMIs within children who have that parental involvement and modeling those healthy eating behaviors and modeling those physical activity habits. But again, the schools can really help with this family engagement by maybe connecting with community partners to provide grocery store tours for the parents and provide cooking lessons for the parents, or even inviting the parents out into the school garden. So really just bringing and engaging the parents and helping them learn healthy eating habits to then model for the children.
So doctor, when you're talking about children who are suffering from diabetes and high cholesterol and really serious health effects, sleep apnea, as they get older, those problems just are compounded, right? So what kind of a life expectancy are we seeing amongst our children that suffer from all these issues?
For sure, obesity and all of its related things will shorten their life expectancy. And we unfortunately in Charleston have a big discrepancy between life expectancy in different neighborhoods, a 20-year difference. However, I am a pediatrician because I believe in prevention and early treatment, so it's not hopeless. Kids that get healthy and start exercising and eating healthier weight, even before they lose weight. They get healthier just from eating healthy and exercising. But when they lose weight, their blood pressure becomes normal, their diabetes goes away. The older you get, the harder it is to turn the corner.
Sure.
But that's why we're focusing on kids and the whole family together. Sometimes when a kid has a consequence like high blood pressure, everybody in the family gets motivated.
Right.
And us adults that have high blood pressure, we really weren't taking care of ourselves or even taking our medicine right. But when the kid in the family has high blood pressure, it's an opportunity for everybody to change their habits and get healthy together. Focus on that kid.
Yeah, that's when the alarm really sounds,
Yes.
right? When it gets really loud. For people who want more information on the work that you're doing at the Wellness Center, where should people go?
We have a website, MUSC Boeing Center for Children's Wellness, that's about our work with schools, but also we have a lot of tips for parents for them to do at home.
Yeah, and a healthy child is a better learner, as we say, right?
That's absolutely right.
Ladies, thank you so much.
Thank you, Layla.
Thank you so much.
We're back after this.